Okay, hi there. I'm Peter Winocour. I'm the Clinical Director for Diabetes and Endocrine Service for East and North Hearts NHS Trust, and I'm really delighted that we're here at the 5th Hertfordshire Diabetes Conference, going from strength to strength, enabling primary care teams to learn so much more about this vital condition, but also to allow a good amount of networking to improve services for our patients living with diabetes. I have in the last 6 months or so taken on a new role, because thinking forward we're going to be looking at diabetes service provision and commissioning across the whole STP, including Hertfordshire and West Essex, and we've kind of established that there are some priorities across the board in terms of diabetes prevention programs and making sure there's wider rollout for that. Also for helping people living with diabetes to better understand how to self-manage, a focus on type 1 diabetes and psychological support for adults with type 1 diabetes, which we need to roll out more widely across the STP. Inpatient care, and particularly a coordinated approach to foot care, which all of the three areas receive funding from. In addition, the telehealth project that East and North Hearts CCG commissioned is, we hope, going to continue subject to funding. This has shown real benefits in terms of supporting disengaged young type 1 diabetes patients, which we must continue because we made real impacts in terms of their self-management, reduced admissions, but also in terms of recognising this huge challenge we face with the large numbers of people with diabetes managed currently by primary care who have complex needs, complex multi-morbidity and increasing therapeutic challenges. And our renal diabetes telehealth model is really looking at a completely different model of care, which ideally the STP will allow us to roll out gradually to support patients with complex diabetes needs in primary care, not just with a yearly visit from a consultant and occasional community DSN support, but in a much more holistic way where we're actually being more flexible in how we help.